聯邦最高法院嘅9名大法官3月26號到28號連續聽取咗關於醫療保險改革法案是否違憲嘅馬拉松式辯論，正反雙方辯論嘅焦點圍繞住響強制全民加保是否違反咗公民自由。大法官本身自由同保守嘅立場最終將會決定呢一項法案是否會遭到部分又或者係全面嘅修正。呢個正係美國近年嚟最重要嘅案件。響最高法院聽取辯論嘅3日裏邊，民眾亦都響最高法院門口以各種嘅方式表達意見，有組織印製精美嘅標語，亦都有民眾自行繪製嘅海報。佢哋仲係唱歌、祈禱、呼叫口號，接受記者嘅採訪，陳述佢哋嘅立場。支持同反對醫保改革嘅民眾幾乎從完全唔同嘅角度切入呢一個嘅爭議。反對者特別重視原則。
I pay for my own healthcare.
Right, so you think all Americans should pay for their own healthcare?
I do.
What about those who cannot afford it?
I think that you just need to learn how to spend your money correctly. Like, you need to pick the things that you want to choose to buy, and it's like going to the grocery store. You don't always have to have those name brand things. You can just buy something that will help you and get you through, and it's somebody's choice. They need to choose what they want to spend their money on and how they want to spend it. And I think it should apply the same to healthcare.
Right. What if they cannot afford anything? Should the government come and help at this point?
No, I think that there's different programs. There's different people out there who are willing to help you. And if you don't have money, there's people around who do have money who want to help take care of you, but they don't want to be forced to help take care of you.
It's my job to find a job. And if I can't find one, then that's not anybody's fault. It's my fault. So I don't feel like my dad should have to cover me till I'm 26, because that's 4 years till I'm 30. I'm 30. Like, no, I don't want to be taken care of by my parents till I'm like 26.
支持者當中大多係有切身嘅經驗。
Because the Affordable Care Act has already benefited so many people in the past 2 years, and I'm a family physician, so I see all different ages and pregnant women as well, and I've seen firsthand the damage that can be done from not having health insurance. I've literally seen people get sick and die because they delayed care and they got really sick when it could have, their illnesses could have been treated or caught early or even prevented.
We have watched as people have died because they haven't had health insurance by the time they get to us. So, we've had 50 cancers out of 1,500 patients. And a lot of the, I'd say like 10 out of the 50 have already died because they got to us too late. They didn't have a plastic card to be able to walk through a primary care office. And they couldn't afford $150 to walk through a primary care office. That's what this is all about. I mean, really, when it comes down to it, it's about truly life and death, and about life, liberty, and the pursuit of happiness, which this country is founded on.
同樣係基督徒，同樣係捍衛生命權，詮釋醫保改革嘅方法卻係有唔同。
Right to life, and we don't like this health care bill. We think that it's going to interfere with our religious freedoms, and we feel like being an American, that's a basic right, and we don't want the government messing around with our religious rights. And besides the fact that murdering little babies is not okay anytime.
Giving everyone a chance to life here in America, the basic needs, it's not against any religion. I think that that's a universal call to love each other. So I think it's wonderful. This bill is great. It gives me a lot of hope looking at the future, thinking about, my life and my children and what the world will be like. So.
醫保改革爭論嘅焦點係民眾對政府角色嘅睇法。
I think government has a function to be a safety net for all. And that's why we have a government. And if it's not acting as a safety net, if all it's doing is preserving individuality, then why would we even need a government?
If you are poor, we have Medicaid, and if you're a senior citizen, we have Medicare. And so we do have those safety nets. But I think, for, the person who loses his job, the community, the church, personal charities, I think they do a much better job than the government do, and I think it would be more cost effective. If we open this door to, again, the government mandating, where does it stop? Today it's healthcare insurance. Tomorrow, what is it going to be? And I just, I think what the founders created was a government that had a very limited role. Believed in state rights, believed in personal freedom and individual responsibility, and that's and in the Constitution, of course, and that's what we're here to protect.
Other developing countries have been the forefront and they get better health coverage for their people than we do. I think it's absolutely necessary, like public education is necessary.
Don't you want to have insurance?
I want all Americans to have insurance, but I don't want our liberties and freedoms to be trampled on. And I think by, having the government tell you or I that we need to purchase healthcare insurance is trampling on our liberties and freedoms.
There's an unequal balance. You've got the Congress that have the best healthcare in the world. They are able to access immediately. You look at Dick Cheney, who just had a heart transplant. Who's paying for that? The taxpayers in the street for the people that are dying. We are paying for those kind of things. So let's even the scales. America's about equality, or it's supposed to be.
We need to start with the ones that we already have on the books that are the programs that we have in that are working right now. We need to reform those and go from there.
I think they're scared. I mean, every time government gets involved, I think everybody kind of takes a step back and goes, why are we doing this, But again, it has to start somewhere. And where else are we going to turn in order to get the country to turn around to help everyone? I mean, that's a big, big project.
不論立場如何，最高法院裏外嘅辯論同樣係精彩，正反雙方都尊重彼此嘅發言權。
So it's part of the Constitution. We all have the right to we all have the right to say what we want. I just don't have to agree.
And most of the people, I don't agree with it, but most of the people have been very decent out here, very nice. And we'll see what happens. Even some of the people who are against it, if you ask them, they'll say they want everybody to have health insurance too. They just don't like this law.
呢一宗嘅案件對中國有乜嘢意義嘅時候，德州檢察總長阿伯特就係咁話。
Well, it sets an example for principles of government and the importance of government not overreaching too much to live within its power.